How do medications like Ozempic, Victoza, Trulicity and others intended for diabetes cause weight loss? According to the World Health Organization, WHO, over 422 million people worldwide suffer from diabetes, and this number is expected to increase in the coming years. While a healthy diet and regular exercise are crucial for managing diabetes, medications like Ozempic, Victoza, Trulicity, and others have gained popularity due to their weight loss benefits. But how do these medications work? And what potential side effects should you be aware of? In this blog post, we'll explore the science behind these drugs' weight loss effects, their pros and cons, alternative options available on the market and some delicious recipes that are diabetic friendly. How do medications like Ozempic, Victoza, Trulicity and others intended for diabetes cause weight loss? These medications belong to a class of drugs called GLP-1 receptor agonists, which work by mimicking the action of a hormone called glucagon-like peptide 1, GLP-1. GLP-1 is released in response to food intake and helps regulate blood sugar levels. By mimicking this hormone, GLP-1 receptor agonists stimulate insulin secretion from the pancreas and reduce glucose production in the liver. But how do these drugs cause weight loss? Well, they also slow down stomach emptying, making you feel fuller for longer periods after meals. This means that you're less likely to overeat or snack between meals. Additionally, these drugs promote satiety signals in the brain while reducing hunger signals. Another significant advantage of using GLP-1 receptor agonists is their ability to improve lipid metabolism by increasing high-density lipoprotein, HDL, cholesterol levels and decreasing low-density lipoprotein, LDL, cholesterol levels. Thus, not only do they lower your blood sugar level but also help with reducing bad cholesterol, helping manage diabetes complications more effectively. Medications like Ozempic, Victoza, Trulicity are effective at managing diabetes and promoting weight loss through various mechanisms that mimic natural hormones responsible for regulating our metabolic functions without causing any additional health risks when taken as prescribed under medical supervision. Pros and cons of diabetes medications. Diabetes medications, such as Ozempic, Victoza, and Trulicity have their own set of pros and cons. The benefits of these medications include the potential for weight loss, improved blood sugar control, and prevention or delay of complications associated with diabetes. However, there are also some drawbacks to consider. Some people may experience side effects such as nausea or diarrhea when taking these drugs. Additionally, these medications can be expensive and require regular injections. It's important to note that not all diabetes medications are appropriate for everyone. Factors like age, medical history and lifestyle should be taken into consideration when choosing a medication regimen. Ultimately, though, it is best to work closely with your healthcare team in determining which medications will work best in managing your specific needs. It's always important to weigh the pros and cons of any treatment plan before deciding on a course of action for managing type 2 diabetes symptoms effectively over time without compromising one's quality of life. How to choose the right diabetes medication. Choosing the right diabetes medication can be overwhelming, but with the help of your healthcare provider, you can find the best option for you. The first step is to understand what each medication does and how it works in your body. The most common types of medications for type 2 diabetes are metformin, sulfonylureas, meglitinides, DPP-4 inhibitors, GLP-1 receptor agonists, like Ozempic and Victoza, SGLT2 inhibitors and insulin. Metformin is usually the first line of treatment because it's effective at lowering blood sugar levels without causing weight gain. Sulfonylureas and meglitinides stimulate insulin production from the pancreas while DPP-4 inhibitors prevent breakdown of a hormone that increases insulin production. GLP-1 receptor agonists like Ozempic and Victoza not only increase insulin production but also slow down digestion, which helps with weight loss. SGLT2 inhibitors lower blood sugar by causing excess glucose to be excreted through urine. Insulin injections may also be necessary for some people if their body doesn't produce enough on its own or if other medications aren't working effectively enough. It's important to consider potential side effects when choosing a medication as well as any lifestyle factors such as convenience or cost. Your doctor can help guide you towards making an informed decision about which medication will work best for your individual needs. Recipes for diabetic-friendly meals. Eating healthy and nutritious meals is essential for managing diabetes. With the right ingredients and recipes, you can enjoy delicious diabetic-friendly meals that won't spike your blood sugar levels. Start by incorporating more fresh fruits and vegetables into your diet. Leafy greens like spinach, kale, and collard greens are great sources of vitamins and minerals while also being low in carbohydrates. Pair them with lean proteins like chicken or fish for a satisfying meal. Swap out refined grains for whole grains like quinoa or brown rice to increase fiber intake while keeping carb count low. You can also experiment with using alternative flours like almond flour or coconut flour as a substitute for traditional wheat flour. Try making simple swaps in your favorite recipes too. Use Greek yogurt instead of sour cream or mayo in sauces and dips, opt for baked sweet potato fries over regular French fries, or make zucchini noodles instead of pasta. With some creativity and experimentation in the kitchen, you can find plenty of tasty diabetic-friendly meal options to keep you satisfied without sacrificing flavor. What are the potential side effects of these medications? It is important to note that while medications like Ozempic, Victoza, and Trulicity can be effective in managing diabetes and promoting weight loss, they may also come with potential side effects. Some of the most common side effects of these medications include nausea, vomiting, diarrhea, and constipation. These symptoms are usually mild and tend to go away as the body adjusts to the medication. In some rare cases, however, more serious side effects may occur, such as pancreatitis or kidney problems. It is essential that patients talk with their healthcare provider about any concerns they have regarding medication use. Moreover, it's worth noting that not all individuals will experience side effects when taking these medications. Each person reacts differently to different treatments. As always, before starting a new treatment plan for diabetes or any other medical condition, it's crucial for patients to weigh up the pros and cons of any prescribed medicine, including its potential risks and benefits. Are there any natural alternatives to these medications? When it comes to treating diabetes, medications like Ozempic, Victoza, and Trulicity have proven to be effective in not only regulating blood sugar levels but also promoting weight loss. However, some individuals may prefer a more natural approach or may experience side effects from these medications. Fortunately, there are several natural alternatives that can help manage diabetes and promote weight loss. One of the most popular approaches is through dietary changes. By focusing on consuming whole foods such as fruits, vegetables, lean proteins, and healthy fats while limiting processed foods and added sugars can make a significant impact on blood sugar control. Additionally, regular physical activity can also aid in managing diabetes by improving insulin sensitivity and aiding in weight loss. Incorporating exercise into your daily routine doesn't have to be complicated. Simple activities like walking or jogging for 30 minutes per day can make a significant difference. Other natural remedies include incorporating herbs such as cinnamon or ginger into your diet, or trying supplements such as alpha-lipoic acid or chromium picolinate. It's important to consult with a healthcare professional before making any significant lifestyle changes or adding new supplements to your regimen. While natural alternatives may not replace medication entirely for some individuals with diabetes, they could serve as an excellent complement to traditional treatments. Conclusion. Medications like Ozempic, Victoza, Trulicity, and others can effectively help patients with diabetes manage their blood sugar levels and achieve weight loss as a secondary benefit. However, it is important to carefully consider the pros and cons of each medication before choosing one that is right for you. It's also crucial to remember that these medications may come with potential side effects and should only be taken under the guidance of a healthcare professional. While there are natural alternatives such as exercise and dietary changes that can have similar benefits without the potential side effects or costs associated with medication, they may not be suitable for everyone. Ultimately, the decision to use diabetes medication or pursue natural alternatives should be made based on individual needs and circumstances. By staying informed about your options and working closely with your healthcare team, you can take steps towards managing your diabetes in a way that works best for you. Remember to always prioritize your health above all else.